It is 12:04 on your Saturday afternoon. We are here. It's John Scholes and Dr. Lou, Dr. Payne, brand new show. If you caught it last week, yeah, we were here and we're back. This is what's going to happen pretty much every Saturday at this time, 12 o'clock. We are here to answer all your questions, get into the subject of pain management and everything under that umbrella. Luigi Nelli, I'll give you your full name out there for all your fans and your former patients or current patients that would say, hey, the guy's on the radio and I had no idea. So you will be here each week. As always, we like to get your calls as we go through the hour, 416-870-6400, star 640 on cell. You know that number, and you can get a hold of Dr. Lou anytime. It is, you give the number out one time. Your number.
1-855-55 Dr. Lou.
You got it. That number is the number we're going to use. So tell us basically, since we're new, well, you and I aren't. We've been talking for some time. We actually found out that we kind of live in the same hood.
Yeah, we do.
Which could be really bad for you because I like to drop in and just say hi when I'm unexpected. But tell us what you want to do with the purpose of the show because we're new.
Yeah, sure. I think the biggest thing for me is really trying to help with pain management and pain prevention. And I think it's a poorly understood area of healthcare. And I think the biggest thing that we can do as healthcare providers is provide education and empowerment to our patients. And I figured this would be a great platform to reach out to listeners that have been suffering through pain or are curious about something or have someone that they know that's in pain and have the ability to call in, talk to us, see if there's any way that we can help. And that's pretty much it. Really trying to demystify pain is the key here.
Yeah, for sure. Again, 416-870-6400, star 640 on cell. You'll want to give us a call to the Dr. Payne Show. We are ready to go. Give me a little background. Now, you've got a lot. Well, first of all, you've got more hair than I do, but you've got no gray hair. So you're younger than I am. So I know that for sure.
Yeah.
But give me some of your background, how you got to doing what you're doing.
Yeah, I guess it started with a passion for fitness and healthcare back in high school. And then from there, I decided to go further my education at the University of Toronto, where I studied physical and health education. And at that point, I was really aware of the importance of health promotion. And I figured a good way to continue that health promotion was to go on and become a doctor. So at that point, I decided I was always very much interested in the musculoskeletal system. And so I decided to go on to chiropractic college. I was accepted. I finished 4 years there. And since then, I graduated as a chiropractor. I own a clinic near where we live, up at Highway 27 in the Finch area. And, I quickly learned after graduating as a chiropractor that the answer to really helping pain wasn't just one person helping with that pain. You needed a multidisciplinary team to really help out with that. So I really tried to grow my practice and my clinic into a multidisciplinary team of every healthcare professional dedicated to pain management. And
talk to me a little more about that clinic. Like what kind of professionals do you have involved in there?
Yeah, we have everything from chiropractors to massage therapists to physiotherapists. We work closely with surgeons that are across the street. We're near a major hospital, which is Etobicoke General. So we have a network with the surgeons there. We've even worked with psychologists, social workers.
Wow.
It's similar to that we talked about last week when someone's pain is being contributed by a psychosocial aspect. Well, the best professional to intervene is a psychosocial professional. And if it's psychological, a psychiatrist or it might be the best person to intervene in that time. And if it's something more social, then maybe a social worker. So we really try to have that multimodal approach.
It seems like, 10, 15 years ago, I mean, when I was going to chiropractic or quote unquote physio, it would be, one or two guys. They had a clinic. It was, sometimes in the bottom of a mall or at the end of a clinic setting. And that was it. This whole approach with psychologists and doctors and pain management, it wasn't really a thing. That's reasonably new, no?
It's reasonably new. I don't think it's new just in the rehabilitation world. I think it's new throughout most of healthcare. We're really starting to understand that most pathologies or ailments that someone is going through are multimodal, therefore need to be approached in that same manner. So similar to there were family doctors that just used to be, just that family doctor in their office seeing their patient. And now we have these big healthcare teams that we're seeing opening up across the world, whether it's something like the Cleveland Clinic or the Mayo Clinics, where it's a big team of professionals really trying to work towards that patient's health.
416-870-6400, star 640 on cell. You got pain. You're wondering about pain and management, how to manage it, something you've been through recently, maybe a traumatic physical event. Give us a call. We'd love to hear from you. Dr. Lou is here to answer your questions and possibly give you some advice. Lots more to go here. Taking your phone calls. The phone lines are open. We'd love to hear from you. We'll get into lots more aches and pains. Oh, back to school, back to work. Boo! Summer's over, and that can lead to a whole bunch of problems on its own. Again, again. We're taking your phone calls after a short break. Dr. Lou, Dr. Payne Show is here. Talk Radio, AM 640. 12 minutes after 12 here on Saturday. Luigi Nally is his name. Dr. Lou, how we will refer to him from here on in on the Dr. Payne Show. 416-870-6400 star 640 on cell. You have pain questions, physio problems, all that stuff. You want to hear from you. Dr. Lou here to answer your questions. I know personally when I get up in the morning now, my lower back feels like a piece of chewed bubble gum, but I'm probably not alone in that respect, right?
No,
and
not
we,
at all.
We mentioned going into the break that things can, you wouldn't often say, and we were talking about this before the show off air, that you think the summertime and back to the grind of work or school, physically, you wouldn't think there'd be much of a change, but you found in your practice over the years that there is a big change when people go back to work or back to school, yeah?
Yeah, for sure. I think a lot changes once September rolls around and the kids are going back to school. And so maybe you're all, as a family, waking up earlier to get everybody put together, ready to go to school and to work. Traffic times are longer during the school year because people have to commute. And so you're spending more time in your car, more time sitting. The grind also kind of starts at this time and will ease off towards December once the Christmas holidays come around. But that means for a lot of people, a lot more time being spent at their desk. And those are all things that can contribute to how people feel in their aches and pains.
What do you suggest to people as far as handling that's concerned?
The people often talk to me about what is proper posture. And really, I think that's a little bit of a myth going back to what we talked about last week about this whole notion of what proper posture is.
Really, eh?
Yeah, I think for sure there's more ergonomically correct postures, but I think the biggest thing going back to what we are as a species is we need to move. So what I always recommend is that every 20 minutes you should be trying to change what you're doing. So if you've sat at a desk for 20 minutes, instead of worrying about sitting up straight or doing this or doing that for another 20 minutes, get up and move around for a minute or 2 minutes. That's the biggest thing. Include breaks where you actually have to change what you're doing. And that goes in the reverse as well, because if you're walking around, well, then maybe every 20 minutes you should sit down and take a rest as well. It's important for our bodies to change what we're doing, and we're dynamic creatures, and therefore we have to be dynamic in the way we're approaching our healthcare.
I was often told that, especially if you have a standing job, now this is old school, but it's sometimes good to put your foot up on a step or of a shoebox or whatever you can, just to give that unevenness in your hips once in a while, right?
Yeah, that's absolutely, and that goes back to taking a break, right? Yeah. So it's just a way for your body. You're standing on 2 feet and you stand up. I know that with people with low back pain, and they'll say, my back really hurts when I'm washing the dishes. We will often recommend that, where we say just open up the cupboards and step up with 1 foot there, and it kind of will ease one side. And same thing though, you wouldn't stay in that position for 20 minutes because that's going to create some pain. So you may need to switch that as well. So the big thing here is every 20 minutes, let's try to change what we're doing.
416-870-6400 star 640 on cell. It's funny, you mentioned end of the summer holidays and then the break at Christmas. Those are things which you alluded to will change possibly your physical routine during the day. And this is something that goes back to the first segment. Those times are good times. You're happy, you're off in summertime, you got holidays, Christmas comes about. Now, does that often bring in the psychological component as well?
Absolutely. There's actually something called, the acronym is SAD, and it stands for Season Affect Disorder. So as our days get shorter, temperatures cool down, they have found psychologically people tend to have poorer moods during this time of the year. And I think it runs from October till about February until the days start getting a little bit longer. But absolutely, the cold weather, the shorter days, I think it goes beyond just those environmental things, and it goes to the social aspect of, like we were just talking about, people are back at work. Summertime seems to be happier. You tend to spend the weekends out a lot more. So there is something psychologically to be said about the time of year that we're in, and the grind and the weather and all those things.
Can that go as far as affecting an injury you've already had, making it worse, compounding the problem?
Absolutely, yeah, for sure. We talked about this a little bit last week about how your psychological disposition affects what you feel in terms of pain. And going back to pain is not an objective measure, it's a subjective matter. And what that means is that, you and I may experience the same stimulus, but we'll feel it different. So you may not necessarily feel as much pain as I would feel to the same stimulus. So it's a subjective experience that each individual goes through. And again, our mind plays a role in this. Everything is processed up in our brain. So if you're going through something like a season affect disorder, that is going to contribute to your pain levels. It's all processed in the same system system called the limbic system in the brain, where emotions are processed, is also where your pain perception is processed. So if one part of that brain is being activated, it has a spillover to those other things.
416-870-6400 star 640 on cell. David and Barrie, opening call. How are you, pal? Good morning, or good afternoon in this case. What's up?
Well, I'm okay. I guess I'm calling, so
yeah, right.
Perfect. Okay. I've been resistance training ever since I was 17. I'm 59 now.
Okay.
Trying to get back into things.
David just dropped off. We'll see if he calls back. We'll give him a minute. Dave, your line dropped off there. You want to give us a call back? We'd love to take you. So let me ask you something. I don't know if you guys have dealt with this, but I've been in different workplaces. Not this one. This one seems to be lit up well enough already. But sometimes you go to places, and it has to do with that seasonal disorder you mentioned. They have these big white lights hanging in the corner, and it's supposed to be a ray of sunshine in the office. Does that work?
I don't know that I can answer specifically saying yes or no, that doesn't work. I don't know enough about the research on those lights to say yes, that's working, or no, it's not working. Right. I guess theoretically it makes good sense. People do prefer light over darkness. And I think it really comes down to the person. For some people it may have an effect, and for other people it may not have an effect.
Does placebo have an effect on pain?
Absolutely. Placebo has an effect on everything in healthcare and everything in our lives, whether we choose to believe it doesn't or it does, and whether we're happy that it does or it does not. But yeah, absolutely, placebo plays a huge role.
416-870-6400 star 640 on cell. But taking your phone calls, if they last, they'll be back, I'm sure. Happens once in a while. So you mentioned the placebo thing. So would a doctor discount placebo in treating someone for pain or for an injury, or do they actually, for instance, would you factor that into it as well?
Yeah, I can't remember the exact, there's a famous physician, and I believe it was Sir William Osler, and I'm not 100% sure, but there's a famous saying that we always learned going through school, and that it's that any physician or doctor that doesn't use placebo is a fool. And the reality is placebo does actually play a role. If you're a practitioner and you're my patient coming in, and I'm saying to you, John, you're likely never going to get better, that's a placebo effect versus me saying, right, John, this is something you can get through. It's just a matter of which way we choose to use that placebo, whether to be beneficial or to not be beneficial. But I think it's important to realize that there's a lot of things out there that aren't necessarily based in good evidence or good research that many people do that they swear helps. And whether that's the actual intervention that they're doing or the placebo, I think the end result is most important, and it's that they feel better.
Doesn't matter if it's snake oil. If it's helping them out, it's helping them out.
Yeah,
right?
and I don't think it's a healthcare professional's job, such as myself, to be recommending snake oil. But you know what? I have had patients that have come in and said some weird things. I remember when I first started practice, actually, it's a funny story. I was treating this person's knee, and I was treating him 2 or 3 times a week for about 4 weeks. And he came back after about a month and totally discredited how much I had helped him, and basically said that what was helping him was every night he was tying a bar of soap to the back of his knee. So, nothing that I did really helped.
It was Irish Spring.
Yeah, it was Irish Spring.
Sorry,
Yeah,
Dr. Lou.
Yeah, exactly. So it wasn't really me that was helping him. But you know what? At the end of the day, what was most important for me as a healthcare provider was he was getting better. Yeah.
416-870-6400 star 640 on cell. Lots more of your calls. Lots to get through here. Dr. Payne Show is here. Dr. Lou is answering all your calls after a short break. Talk Radio, AM 640. 1223, taking your calls and all that stuff right up until 1 o'clock. Dave, you're back. Hi, Dave.
Yeah, I guess I got to pay my bill. I don't know.
So you've been basically lifting weights for resistance training your whole life. Continue.
Yes, left shoulder, they gave me cortisone for the bursitis. I guess that got inflamed, and I had the tendon issues, shoulder tendon to the bicep and to the chest, but I think it's on the outside of the shoulder, so I think it's the one going to the bicep inflamed, and we can't seem to get that under control. Can I get a second cortisone, or is there special exercises I should do?
Yeah, that's a good question, Dave, and thanks for calling. I would say that specifically, it's going to be hard for me to answer specifically what could help you exactly, just because I would actually have to properly assess and make sure that what you're telling me is accurate to what I can see. But I can tell you right off the bat, with something like a cortisone injection, those are things that you want to be cautious with repeatedly doing those cortisone injections. Wow. Cortisone does tend to decrease your bone mineral density. So someone like Dave, and Dave's a male, so it's a little bit better, but a female, already their bone mineral density decreases more substantially, and osteoporosis is much more prevalent with females. But anybody, as we get older, after about 30 years old, our bone mineral density seems to go down. Now, the good news is if you do a lot of resistance training, what you do is you just start at a higher point. And it sounds like Dave has been doing a lot of resistance. So he probably has very good bone mineral density, and it's probably not a huge concern. But over time, especially with something like the shoulder, as you get older, you don't necessarily want to decrease that density in the bone because it predisposes you to fractures, and that could lead to some very serious problems. In terms of your specific problem there, Dave, I think the key here is you really need to have someone who can look at this and kind of go through it properly with what you have going on. And something I think that's important to mention to our our listeners as well is that although I have a specific clinic at Highway 27 in Finch, Dr. Lou's Pain Care does have a network of providers that we trust across the GTA. Right. And I'm not suggesting that those are the only good providers out there to provide this stuff. But if our listeners want a second opinion and they want a second opinion from a Dr. Lou's trusted provider, that's definitely something we can help arrange. So I think, Dave, the biggest thing with you is you need to get it checked. You need to speak to a knowledgeable professional who can actually assess it properly and look at, because it sounds like it's a long-standing issue and it's chronic, and it's not going to do it justice for me to just, there's no simple answer is the reality.
Yeah, like we've done the ultrasound.
Yep.
And what showed up there, and say I'm 59 now.
Yeah.
So I know Doc keeps telling me you're not 29, you can't push it the same way.
Right.
So I have gone lighter weight, but it just seems like as soon as I rest it and it's okay, the second I put any kind of resistance on it, it comes right back.
Right. The thing here, too, is a lot of times with these types of injuries, it's also about function, the proper way that your shoulder is working. So sometimes you can't necessarily fix the tendon or the bursa, but what you can do is change the function of the shoulder girdle so that you're doing things in a way that it's not putting extra pressure on that tendon and that bursa. And I think if this is a long-standing issue, that may be a better approach for you to go with is looking at the function of your shoulder and how can you improve that shoulder in terms of function and not just necessarily focusing on the inflammation or the bursitis.
So more focus on the kinesiology piece of it.
Correct, right. The way that your scapula is going to sit on your rib cage really determines what happens at the glenohumeral joint. Yeah.
Wow, look at the language is incredible here. Dr. Lou, you sound like you know what you're talking about.
Yeah, I guess I didn't waste a decade.
Yeah. So it's like changing the angle of my bench, if you will, changing the angle of my shoulder press, whatever, just modifying it that way to take the stress off.
That's right. Yeah. And if that's something that you're knowledgeable enough to figure that out on your own, that's great. But if you need a little bit of help, there's plenty of professionals out there that can help you figure out that kinesiology aspect of your body and what things are going to be better. And that's going to alleviate the pressure, because once you can use those proper angles, what's going to happen is just secondary, that inflammation will go away on its own, and you'll be surprised and you'll think, why didn't I change that, 20 years ago?
Yeah, right. That's it. Thanks a lot, Doc. You've been really encouraging for me.
Yep.
Dave, appreciate the call. How would a shoulder, I mean, I guess, again, it depends person to person, but someone who's 29 versus a guy like Dave who is 59, how much, because that's a weird joint. The shoulder goes all different ways, right?
The shoulder's probably, in my opinion, the most difficult joint to actually work on in the human body. The thing that's so unique about the shoulder is that if you took away the muscles, your arm would just fall off.
That's
everything
nice.
Everything else has an inherent stability.
Right.
Like if you look at the elbow, the bones kind of fit in a nice puzzle piece, so that provides an inherent stability. However, the shoulder is just a joint hanging off your torso. And if you took away the rotator cuff muscles, which are the muscles responsible for holding that shoulder in place, it would just fall off. And that's why those injuries are so prevalent. And also, that, like you alluded to, John, is it moves in so many different directions. Your elbow flexes and it extends, whereas your shoulder can go any which way.
416-870-6400, star 640 is the number. Anytime you want to get a hold of Dr. Louie is here right till 1 o'clock. He can answer those questions. Bring on your calls. The lines are, wide open. We love to hear from you. And if you need to call him when the show is over, that's simple as well. 1-855-55-Dr. Lou. It's Dr. Payne Show. It's right here on Talk Radio, AM 640. Halfway through this hour already, 12:30 here in your Saturday afternoon here, AM 640 at Dr. Payne. Dr. Lou is here to take all your calls, dealing with your pain management. And taking your calls, you have mysteries. Sometimes you just have pains and you have injuries that have lasted years and years. And to no avail, you've tried to get help. Nothing else has worked. Suggested going to your clinic and letting someone, or at least maybe all the people on your team, have a shot at it, right?
Yeah, I think it's worth a shot for most people out there. I think they'd be happy. We have, like I mentioned, we have our flagship clinic, but we also have a network of trusted providers that we've personally vetted, that I've personally vetted, to know that they're going to provide the standard of care that I think is so important in pain management, and that provider network is across the GTA, because we know not everybody can make it to the flagship location.
Let's talk about that pain management for a sec. Sometimes it's just, well, I mean, let's face it, with how busy people are, sometimes it's easy just to grab a bottle of a couple of something, pop them back and deal with your pain for 4 hours, maybe 8 if you're good, depending on the commercial on TV. But where in the pecking order, as far as how you treat people, does it come to that point? As far I'm talking pills now.
Yeah, and I think medication plays a role in pain management. Going back to everything plays a role. I know, for example, I'll give you my personal experience. I love to golf, and when I go out to golf, I tend to have a bad back too. And when I know I need that 4 or 5 hours of quick relief, I usually will take a Tylenol or an Advil. So it does play a role. I think the bigger danger becomes once you start chronically abusing these medications, right? Because of the negative effects that they could have. So that's where I think it becomes the bigger concern. Also, sometimes you're just in way too much pain for someone to actually physically intervene. I know when we see a lot of people at our office and they walk in or they don't walk in, they're being brought in by somebody and they just threw out a disc, for example, we're sending them back home and telling them to take medication and come see us in 3 to 5 days, because there needs to be a certain amount of time.
There's a threshold, isn't there?
There's a threshold.
Yeah.
That's right. You can't, in order to intervene physically, that person needs to be at a certain physical health. And, if they're that bad, then really the answer at that point is medication. And you know what? Unfortunately, sometimes medication also becomes the answer, and it's something that you'll need to use day to day in order to help you manage it for the rest of your life. Yeah. I think the key is trying to minimize that aspect and never getting addicted to any treatment. And I don't just mean just with medication. I don't think anybody should be addicted to even going to see a physiotherapist every week. I think there should be an onus put back on the individual. How do you yourself help yourself? But you know what? Sometimes it plays a role. And the other thing here too is we don't know what people have been through. Some people have been through such traumatic car accidents or work accidents that there's no choice but to have that medicine used every single day or treatment used multiple times a week. And I think that comes back to the conversation that our listeners need to have with their healthcare providers is how do you minimize how much external things you're using, and how do you maximize how much of the internal capacity that you have to minimize your pain?
416-870-6400 star 640 on cell. Love to get your calls in here. Let's talk a little bit about stretching versus warming up. I mean, the old school advice was get up in the morning and go and touch your toes 3 times before you get downstairs.
Yeah,
I personally never thought that was a good idea. You've been lying dormant still all night, and then all of a sudden you want to go over and touch your toes. Give me your opinion on stretching versus warming up.
I will not only give you my opinion, I'll give you some of the best research that we have available to us. Oftentimes we speak of stretching in terms of injury prevention. So let's focus on stretching for injury prevention. What the research has actually found is, let's take, for example, someone who says, I have tight hamstrings, quote unquote tight.
Who doesn't?
Oftentimes tight is actually the wrong word to be using. What they actually have is short hamstrings. And so they've done research where they've taken muscles out of cadavers and hung them with a weight for days. And they've watched this muscle stretch over time, and then they'll take the weight back off. And the half-life is something like 20 minutes for it to get back to almost its original length. And so the point of the research was, is you stretching for 10 seconds actually going to lengthen your muscle? Probably not. And what they found was more important from an injury prevention standpoint was warming up, because you have enzymes in your body and in your muscles that function at a certain temperature. So that's the whole thing of, you don't want to be cold when you go out to do something. You want to be warmed up because it allows those enzymes to work at their proper level because of the temperature that you're using. And that's what actually prevents injury, is is warming up. Dynamic stretching is much more beneficial than static stretching. So a good example of something like dynamic stretching is like something like yoga, where you're not necessarily staying in one position forever. You're actually changing stretching positions. So warming up in terms of injury prevention is much, much more important than stretching. Am I saying that stretching never plays a role? Not necessarily. It's just not that good for injury prevention. But it may play a role if your provider thinks that that short hamstring that you have needs to be lengthened a little. The thing is, you almost have to be religious with how much stretching you're doing based on the research.
So underneath that, underneath the umbrella of warming up, how important, along with the enzymes, does oxygen play a role?
Oxygen, I mean, the oxygen is the most important thing for us as humans,
especially
obviously,
as muscles, right?
We could survive a couple of days without water. We could not survive very long without oxygen. So it's actually probably the most important thing. And our muscles do need to, when you see a picture of the human body, we often see muscles as red. They're red because there's oxygen in those muscles. And so it plays a very important role in anything that you do. And in fact, when we tell people, for example, to do exercises in our clinic, we often will say, don't hold the contraction for longer than 8 seconds, because at that point, that's when you start to starve the muscle of oxygen. And that's actually dangerous. That could lead to injury. So oxygen is very important. It's very important for everything that we do in our lives.
416-870-6400, star 640 on cell. Andrew in Pickering, good afternoon. How are you, pal?
Good afternoon. How are you, Paul? Great day for talk radio.
You bet. You got a question for Dr. Lou? Go ahead.
Yes, I want to ask the doctor about generic pills, because I have a heart condition, and I was on generic pills for quite a while, and the pain was just unbearable, right? And a lot of times you would hear doctors would say that the pharmacists would prescribe the generic pills because, all this thing to do with insurance and everything, right? But why do they still prescribe when a lot of people, I hear a lot of complaints about the generic pills, why do they still make them? Why do they still prescribe them?
Yeah, that's a loaded question.
Yeah.
I think the biggest thing here is when you're looking at, now correct me if I'm wrong, you're taking these pills for your heart problem, is that right?
Yeah, I was. But now I am on the real pills, which my pain subsequently just went it was like 9 days.
Yeah, so and that may very well be a case. This is also a case going back to where maybe placebo played a role, right? Your belief that something that's not generic may have a more beneficial effect. When you look at a lot of these pills, I have some close colleagues that are pharmacists, and when you look at these pills, whether they're name brand or not name brand, what it really comes down to is the chemical composition.
Sure.
And really that doesn't change when you go from something that's, a more popular brand to something that's not
brand
a popular.
X.
Yeah, exactly. Yeah. It's still a chemical composition, and perhaps, and I don't know for sure, right? Because going back, and also I'll precurse this by saying I'm not a cardiologist, and this is not my area of expertise. But I will say that maybe there was some type of placebo effect for you, where you thought having a more name brand pill may be more beneficial than you, and maybe there wasn't, and maybe just for whatever reason that name brand pill reacted better with you, and you're doing better. I think again, going back to what's most important is that you feel better, and don't be afraid to have these conversations with your doctors, right? If you're taking something and you're not feeling great with it, that's what they're there for. You have to go back and say, hey doc, this isn't really working for me. Is there something else? And try to change it up in that regard.
Awesome. Thank you, man.
No problem. Take care.
It's funny because, we've all known that. For instance, you go take, a cough and cold like a Neil Citrin, you get the generic brand or the store brand beside the real article. You look at the back, they've got the same ingredients.
It's the same ingredient. Yeah. It
should be the same.
It should
be.
I mean, I would probably think that in some cases there's some minor things that are adjusted in order to make a trademark or whatever. But at the end of the day, I know the pharmacists that I know say it's all the same stuff.
Is there ever a time where placebo can be dangerous?
Yeah, of course. I think like anything that we have is if it's used in the right way, it usually is beneficial. And if it's used in the wrong way, it could be very dangerous.
Someone might say, I feel better, must be the cure-all to end all, so I'm going to stop treatment. Right?
Yeah, and that's a very dangerous thing. Yeah. I don't think that oftentimes people gain a little bit of knowledge, and a little knowledge can sometimes be a dangerous thing as well, right? So this is where I'm a big advocate of always keeping your healthcare team involved in what's going on, and you shouldn't be making those choices on your own. I know with us, one of the things that when we're building plan of management for a patient, we like to have the patient involved, and we want to know what it is that they're comfortable with, what they're not comfortable with. But again, it's a dialogue. The professional should not be making the choice alone, but neither should the patient. It needs to be a dialogue between both.
Take a quick break. Your calls. We'd love to hear from you. You got questions for Dr. Lou? Not a problem. 416-870-6400, star 640 on cell. The Dr. Payne Show continues. It's right here on Talk Radio, AM 640. Yeah, Dr. Lou, your home clinic, of course, is up at Finch and Highway 27. What's your exact address up there?
100 Humber College Boulevard.
That's it, right?
Yeah.
I knew.
We have a couple suites in there, right. Suite 101, 201. But yeah, we're at 100 Humber College.
Yeah, you need to get a hold of 1-855-55-Dr. Lou, or call us here at the radio station. We'd love to hear from you for the next 15 minutes or so. This one must come up at your clinic every day, all day. Ice versus heat.
Yeah, it's definitely
break it down, man.
Yeah, and there's no perfect answer to it. Usually what I try to make people understand is if it's an extremity, so let's say it's your arm, like an elbow or a wrist or an ankle, and you've just recently injured it, and you can visibly see some type of swelling and bruising, that's where ice is going to play a really beneficial role. Versus if you're dealing with bigger parts of the body, like the low back, and it's more of a chronic issue, heat is going to be more soothing in that regard. Also, the big thing with ice is its biggest use is to decrease inflammation. So you have to be certain that there's inflammation, and that's why in the extremities, it's easier for a person to visibly observe swelling in their wrist than it would be in their low back. And so oftentimes you don't necessarily want to be using ice if you don't know there's no inflammation. So therefore, you would go with heat. So I would say, as a general rule, for chronic aches and pains in the bigger parts of the body, I would prefer to use heat. And if you're dealing with a more acute injury and it's in the extremities, I would go towards ice. But now we can look at some ancient healthcare systems like Chinese medicine. Chinese medicine never ever uses ice. They never ever. There's one of my mentors actually also practices Chinese medicine, and it's just not something that they use.
Never use ice. What do they do for swelling?
I don't know. You also have to think back that their system is thousands of years old, and they didn't have fridges and freezers. So you kind of adapt to what you have too, right? So, but for whatever reason, they've continued to adopt that type of model. But again, we're going to base this more on the more conventional type of healthcare that we provide, and those would be my general guidelines for the heat and the ice.
So what exactly is happening to a part of the body or an injury when you put that heat on it? Because people just put heat, it feels better, they turn it off, they don't think about what it's doing.
Yeah, it's really just a soothing effect. So a lot of the times with a chronic low back pain, your muscles tend to tighten up, and that's why you have that chronic low back pain. Going back to the analogy that I used last week of putting a piece of meat in the freezer is going to make it tighten up, versus if you bring it out and you let it thaw, it usually becomes relaxed and it's more pliable. So that's kind of the goal with heat, is that you want to try to make these muscles a little bit looser and more pliable, so that way the theory is it's not going to be as tense and not cause you as much pain. And sometimes that thinking is flawed. It really depends, right? And even we may have listeners out there saying, well, I have chronic back pain, but I use ice and that's much better than heat. And that may very well be true. There's no good answer to this, to always say that every time in this scenario you use heat or you use ice. A lot of the times too, it comes down to the individual. And oftentimes when I suggest something to a patient and they come back and say, Dr. Lou, you told me heat, but I put ice on and it felt better. Well, guess what? My advice just changed. Then use ice, because if that's what makes you feel better, then, we don't know everything on how it reacts with the individual. And that's the big thing about healthcare and about anything. We need to look at this as an individual, not as just what is our prescription for this type of ailment, because this ailment exists in an individual, and what benefits that individual more.
416-870-6400, star 640 on cell. You've got pain questions, you're in pain, you've got an old injury, no satisfaction. Give us a call. Dr. Lou is here to answer your questions. So yeah, it does really come down to the individual. I mean, I'm going to be different than you. It's going to be different than, Heather, our producer. We're all got different bodies. We're all human, but we're so different. Even the same injury could affect us 3 different ways. So talk a little bit about the assessment when someone someone first comes in your door for the first time? How does that work?
Yeah, the assessment, the biggest part of the initial assessment is the history taking. There's also another saying in healthcare that if you listen to a patient, they're telling you their diagnosis, because that's essentially that's essentially what we are. We're kind of detectives of the human body. So we're listening to something and we're trying to build out the story. So, we'll know the specific questions to ask. So we take a comprehensive health history where we look at everything from the complaint that you're here for, all the way to your past medical history, to your family medical history, because a lot of things are genetic and run within the family, to the social things going on in your life, the psychological disposition that you may have. And so you have to take into consideration this person's story. That's what the history is. It's not just merely I have low back pain with leg pain. There's so much more to that. You have to get this person's story. Once you have that history taken, then it becomes the physical exam component, where there's some physical tests that you can do there in the office. So if you're dealing, if you're dealing with a knee, you'd be doing specific orthopedic tests, checking some reflexes, checking the neurology, checking the muscles. And then there's also sometimes special tests and imaging. So if you feel that this person may need an x-ray to understand a little bit more. So it's a process. So we usually start, and it always goes kind of that way, where it's a history, some type of a physical exam, followed by special testing if needed. And once we have that together, then we can come to a diagnosis for the person, which is essentially telling them what's wrong, and then provide a prognosis, which is telling them how likely they are to get better. And then you suggest a plan of management, and that plan of management is going to include the things that would help their diagnosis and their prognosis.
416-870-6400 star 640 on cell is the number to call. Crystal in Barrie. Good afternoon, Crystal.
Hi, how are you?
Good. You got a question for Dr. Lou? Go ahead.
I do, and bear with me. I am driving, so I'm cutting in and out. So
hands-free, right?
Yes, of course. So I'm a nurse at RVH in Barrie.
Yep.
For the past, year or so, I've been having extreme lower back pain to the point where if I bend over to tie up my kids' shoes, I'm wanting to cry. If I'm sweeping the kitchen floor for under a minute, I want to cry. So I went in to see my family doctor about 6 months ago, and he ordered, I want to say a CAT scan or an MRI, I can't remember which. Basically, he called me in the office, said I had spinal stenosis.
Yep.
And then my L3 or L4, the lower discs, they were herniated. Like, I guess he was saying where the cartilage should be, it's kind of bone on bone.
Okay.
But then I went to follow up because he sent a referral, and he has since retired, and I haven't been able to follow up.
Right.
So with that being said, I've had to leave work last week twice because my lower back, it feels like there's a sledgehammer banging on my lower back.
Okay.
And now when I'm sleeping, I wake up with severe hip pain. So I'm just wondering, because I can't see him again to follow up, is there anything I can do, with this spinal stenosis? And then another thing, it's not like I had an injury, so I'm not sure how the stenosis would have about.
Yeah, stenosis is a degenerative process that just happens over time. And what it essentially is you have something called the IVF, which is where the nerve exits the spine to go into the extremities. Once that hole that exits starts to get smaller, there's a narrowing. In the optimal scenario, it's separated into thirds. So a third of the space is taken up by the nerve root, and the other 2/3 is just empty space. And as you develop stenosis, and I'm assuming based on what you're describing, there's a difference between central and peripheral stenosis, but based on what you're describing, it sounds a little bit more like peripheral stenosis. What ends up happening is that whole, less of it is taken up by, less of that free space is available, and therefore the nerve has really nowhere to go. And once the nerve gets impinged on, it causes pain in the legs. And a lot of times with stenosis, with neurological stenosis, like Crystal's describing here, you'll have people complaining of when they're walking, their legs start to go numb, or they feel numbness and tingling on both legs. But then when they sit down, they'll start to immediately feel better. So a quick advice on the spinal stenosis, because it's a very, very complicated issue. But standing up straight will cause that hole to be a little bit smaller. Whereas if anything, where you're bringing the knee to the chest, it allows that to open. So one exercise is just laying down on the ground, bringing your knee to your chest. And another good thing, there's actually a spinal stenosis program down at the University Health Network. And what they found is riding the bike is awesome for this
No
as
kidding.
well. Because
Wow.
you're kind of in
It's a
your
seated
hip
position,
Yeah,
for
it's
sure.
a seated position. Your hips are a little bit flexed. So you're still getting that cardiovascular benefit that you would from walking,
Nice.
except you don't have to walk and be in pain. So bike riding and bringing your knees to your chest, Crystal.
Okay, and I also found, like, when I'm at work, because I can't just sit down with, like, the Emerge tends to be busy all the time. So what I noticed is sometimes for relief, I'll just stay standing, and then I, like, bend over to touch my toes, and for some reason, it feels like it's pulling my lower back, so I kind of get a bit of relief going that way. And then just one last quick question. When I do see a specialist, or is this even something that I can come and see you for?
Yeah, absolutely. And that was my next thing. I don't think that this is necessarily, a specialist isn't going to do much because a spine surgeon, unless this is debilitating and function is impaired, won't operate on this. This is a rehab question. So you can give us a call at our 1-855-55 Dr. Lou number. And we have providers up in Barrie, because I see that's where you're calling from, that we can connect you with.
Excellent. Again, that number 1-855-55 Dr. Lou. Lots more of the show coming up. We'll get to your calls. Beth, hang on. We'll get to you as well. 416-870-6400 star 640 on cell. This is the Dr. Payne Show on Talk Radio, AM 640. 12:56. Last few minutes of this hour flies by quickly, my friend, but we are back here every week, noon on Saturdays here on AM 640 with Dr. Lou. Outside of show hours, if you need to get a hold of him, no problem. 1-855-55 Dr. Lou. That's DRLOU. Dr. Lou would be the number you want to use. Beth in Bradford, thanks for hanging on through the break. What's up, Beth?
Hi. My husband... Oh, sorry, my dog.
Sit.
My husband was involved in a car accident in June of 2015.
Yep.
He developed meningitis in October 2015. Now, with the result of the car accident was he suffered a concussion.
Right.
Okay. Now, he's been going for therapy since July 2015.
Mm-hmm.
Suffers terrible headaches. He's been to chiropractors. He's tried acupuncture, massage therapy, heat, cold. I don't know what to do with him anymore. Sometimes he cries. The headaches are so bad.
Mm-hmm. Yeah, it's, we deal a lot. Actually, one of the other businesses I own is just dedicated to car accident assessment. And, a lot of these things, people don't realize how much a car accident can impact their life and these severe things. And a lot of the times, these are the harder things to deal with is once you get into the concussions and the headaches. Beth, with your husband, I really think it comes down to, and I'm not sure who they're seeing or who he's seeing or not seeing, but there needs to be something done where they're looking at him and also having him actively involved in his care. And I know you mentioned a lot that he was seeing chiro, massage, and physio, etc. But were they giving him home exercises to do and proper diet and all these things? Because especially when you get into something like a headache, those are really important factors, the active component that the individual has to do in order to try to make a change.
And again, this goes back to the assessment, right? That's why it takes so long to delve in and find out exactly their history and where they've been, right? Even if it is a car accident.
Yeah, absolutely. That's what it really comes down to is figuring out the specifics of the story. When you hear something like that car accident, in my office, I'd need to find out exactly what happened in this car accident, what the mechanism of injury was, the things that were done post-accident immediately, because that matters too. Doing the right thing right away can make the world of a difference later. And a lot of people don't have that necessarily knowledge to do the right thing right away.
Car accidents, that means snow and rain. And anyway, we'll deal with that with the months to come. That's going to happen. We're done for this week, guys. In the meantime, the number is 1-855-55 Dr. Lou. 100 Humber College Boulevard is where you'll find the clinic right up there in Rexdale. And until next time, get a hold of him. Dr. Payne Show with Dr. Lou right here at Talk Radio, AM 640.